I am joined now by Dr. Claudio Benediva. He is from the Center for Advanced Reproductive Services at UConn. Doctor, thank you so much for being with us to talk about fertility treatments in these unprecedented times.
Thank you for having me. Good morning.
Good morning. You know, it's so hard, I know, for women in general and their partners because they're already playing this waiting game. And so this can be really a difficult time, I imagine, emotionally with all this upset, because now people are having to sometimes wait even longer.
Yes, certainly. That's been very hard for everybody, for all our patients, for the physicians, for all of our staff. Unfortunately, we're living challenging times, so that's why we have tried to find some ways to sort of alleviate or mitigate the effects of this pandemic on our patients, and try to implement some measures that we can sort of continue taking care of our patients while we wait to be able to resume our normal activities at the center.
And the bright spot is you're offering these virtual fertility visits. So not all is lost. Talk about how you're virtually helping people with their fertility issues.
Yes, so what happened is just following federal as well as state guidelines, as well as our governing body, the ASRM, that's the American Society of Reproductive Medicine. They came out with recommendations to temporarily suspend all the fertility treatments. So we did that about a couple of weeks ago, but we find that a lot of patients, they are waiting to have their appointments, their consultation with their physician, and in trying to keep with the social distancing guidelines, we find, as many other physicians, that we can do a lot online. So we give the patients the option to either a phone call with the physician, or we can set up a video conference, which is actually been working very well. It's amazing how much we can accomplish sometimes online. The patients can be at home, keeping with the recommended quarantine, and we can chat with the patient and with the couple. Sometimes they're both home, so we can talk to both of them, and we can get the ball rolling. At least once we are able to resume, hopefully relatively soon, the normal activities, they will not have to wait to get another appointment. We anticipate once things get back to normal, we're going to be very busy. So the more we can accomplish now online, the better for the patients. So they can start doing some things. For example, with these virtual appointments, first we get the patient's records. We can review their previous records, what kind of testing or evaluation they've done before. And then when we call them, we get their medical history. We ask them more details, more information, and we can start getting some things going. For example, a lot of the preliminary blood work, hormone testing, the labs are open, and they've been very, very good at giving patients schedule appointments, so nobody congregates in waiting rooms. Mm-hmm. So they have a time schedule when they come to the lab. They get their blood drawn, and we start getting those results. So those kinds of things we can start doing now. So hopefully in a few weeks, when we're back to normal, we can start whatever treatments they require.
Yeah, and I'm here, for those who have just joined, I'm here with Dr. Claudio Benediva, and he is the director of the IVF laboratory. I know that you have suspended the actual procedures right now for IVF, but what we're talking about is there may be women out there who've been wondering, do they need help? So we want to ask some of those questions right now to give people a guideline, because this is where these virtual appointments, maybe you can feel like you really are still hopeful and accomplishing something, because as you said in the beginning, a lot of times it's just parsing out what help you might need, and this is something you can do on the phone. So number one, you say if you're under 35 with regular cycles and no pregnancy after a year, you might want to schedule a virtual appointment to find out what your options are.
Oh, absolutely. So in general, we recommend if somebody, age is very important, as you mentioned. So if somebody is less than 35, if they've been trying for 12 months, now if they're over 35, if they've been trying for 6 months, I think they can benefit from scheduling one of these virtual appointments so we can review their history, ask them a little more information, and maybe start getting some blood work and some preliminary testing done, and give them some guidance and get the ball rolling. If the patient is over 40, I would say after 3 months of trying, they should contact us to get some testing done and decide if any additional intervention is going to be needed.
Now, just to be clear, if you are still seeing patients and they've had a successful IVF treatment before all this happened, those appointments are still safe to go to? They still need to keep up with their regular appointments?
Yes, so we still here in the clinic. You can see I'm still here, and we see all the emergencies. So we are 24/7 available for emergencies. All the many patients that have been successful with the treatments and they are currently pregnant, so we follow their pregnancies. So we're here for them, and we do their ultrasounds, whatever monitoring is necessary. So we have been able to finish all the treatments that were already started. What we have temporarily put on hold is initiating new treatments. There are some exceptions if there are some emergency situations, for example, patients with cancer that they need to start chemotherapy, radiation, and they need sort of an emergency IVF for fertility preservation or to freeze their eggs. We will take care of them because those patients cannot wait. But otherwise, we are following the guidelines and the recommendations, put all the other treatments temporarily on hold until hopefully we can get back to normal soon.
You mentioned freezing eggs, and I just recently was interviewing one of your doctors about you were going to have a big event where people could have come and found out that information, but it might be a good opportunity to talk to those who are at home who are wondering, should I freeze my eggs? I understand freezing eggs has gone up by about 75%. You can't do it right now, but it's something that a lot of women are considering to sort of freeze time.
That's a great point, because right now, we are really available. We are probably more available than ever. So it's very easy to get a hold of one of us and schedule one of these virtual appointments. And even if you are not sure if egg freezing is for you, if it's something you should consider, call us. We'll talk to you over the phone. We try to get your history, see what your situation is, your personal situation, with your age. We can do some testing. So we can do some hormone testing that will measure your egg reserve and your egg supply. That can be done in our lab and give you some guidance in terms of whether or not you should consider egg freezing. And although we are not going to be able to freeze the eggs this month, but we can start preparing if that's what the patient decides to do it as soon as we resume normal activities at the center.
Is there a certain age that you recommend people freeze their eggs by?
Well, in general, I would say it's somebody who is over 35 and is not ready to start a family should start at least thinking about it and maybe talking to one of us and decide if it's something that they should consider. It depends on their circumstances, how long they're going to postpone. If they're going to postpone pregnancy for a few months, may not be necessary, but if they think they're going to be postponing for a few years, is something to consider. I think probably at any age. I think we offer, periodically, we offer some free hormone testing for women to measure their egg reserve. So if somebody, even if they are a little bit younger, but the test shows that they have a diminished egg reserve, maybe it makes sense to start considering freezing their eggs for the future fertility.
So we want to let everyone know that this virtual appointment is open. I know that a lot of these virtual appointments, because the government has relaxed regulations, they're being covered by insurance, but people can go to yukonfertility.com. They can also call you. The number is 844-467-3483. Can you kind of talk us through, if people are wondering, should I schedule a virtual appointment? What would that entail, and who should schedule one?
Well, I would say anybody who is worried about their fertility, Anybody who was planning to schedule an appointment with us, and now they're probably wondering if the clinic is open. So we are, and they don't have to come here. We can keep everybody safe and keep our social distance, but they can contact the number you just mentioned, schedule the appointment any way they feel more comfortable. If they prefer to speak on the phone, we can do it that way, or we can schedule a video conference, which is really nice because we can, you can see their faces, you can interact better with the doctor. We are actually able to show some graphs and documents on the computer so the patient can see them and we can interact better. They can have their partner in the same video conference. So I would say anybody who is worried about their fertility, anybody who was already considering making an appointment to come and see us, we are here. Some of us are doing it from home. Some of us will do it from our office. But because of what we discussed before, because we have suspended all the procedures and all the other treatments, we really have a lot of time available to talk to patients. So don't be shy, and even if you're not sure, just it's very simple to have a phone call and then decide if it's something you want to pursue as soon as we are back to normal activities.
I think it gives people hope. They can begin the planning stages. They can ask their questions. Just want to let you know there is someone on the feed. I'm not sure how to pronounce her name. It might be Megan Bakaj. But Dr. Bennett, hello. He helped me have my twins as a surrogate for my sister. So she's saying hello.
That's great.
And let me just talk a little bit. So many pregnant women are worried. This is a tough time. You're worried about everything when you're pregnant anyway. I know I used to worry, can I have that turkey sandwich? Do I need to microwave it first? Should you avoid a soft cheese? This adds to the anxiety. What are you advising your pregnant patients, especially for those in your care who've worked so hard to become pregnant?
Well, of course, that's been a big concern for everybody. What is the impact of this virus on pregnancy, on the babies? Unfortunately, it's not a lot that we know because this is a new virus, so we're just beginning to learn about it. But the good news is that all the information that we're getting seems to be pretty reassuring. It doesn't seem to affect the babies. It doesn't seem to cross the placenta, and the complications seem to be minimal for patients that unfortunately get the virus while they are pregnant. So again, too early to tell, but so far what we know seems to be very reassuring, and it should have the same precautions as everybody else. So being pregnant doesn't change it. Everybody should wash your hands, avoid touching their faces, and keep the social distancing, and follow the CDC guidelines. That applies to everybody. Pregnant women are not more vulnerable than anybody else.
Okay, so that's some encouraging news. You know, there's been a lot of negative news out there. Are there any bright spots, any happy stories in your clinic right now?
Well, as I mentioned, we do have a lot of happy stories, and we're still taking care of them, and we're seeing them. A lot of patients that have conceived until a couple of weeks ago, when we were providing the regular treatments with IVF, with inseminations, whatever the patients needed. So we are still following all those patients, and they have a happy ending to their treatment, and we are really just hoping that we're able to resume that soon, so we can continue to bring the same happiness to all these other patients that are unfortunately have been now waiting to resume their treatment.
Yeah, I know the waiting is hard, and we're thinking of all those families out there who have to be a little bit even more patient now, but it's great to know, and we encourage everyone to share this information with anyone who might need it, that you're accepting these virtual appointments, and hopefully that will give people a little hope. They can at least do some planning and maybe some initial lab work, as you said, to get going.
Exactly. And I have to say the patients have been very understanding, even though we had to sometimes stop or treatments that were beginning. Everybody's been very understanding and wonderful in trying to work together until we get through this. We will get through this.
Dr. Claudia Benediva, thank you so much for being with us, and we'll encourage everyone to go to that information, UConnFertility.com. The phone numbers are there, and you are accepting virtual appointments. So perhaps that's something someone can schedule and have a little silver lining in their life today.
Thank you. Thank you for having me.
Thank you.
Stay safe.
You too.